We are telling pregnant women in many hospitals in the state to be very careful in the last month prior to delivery with social distancing, masking, washing hands. And the reason for this is that pregnant women are probably more susceptible towards the end of their pregnancy to a severe COVID-19 pneumonia. In Washington state, we have seen that 1 in 7 women are hospitalized with COVID-19, and 1 in 8 women might have a severe COVID-19 pneumonia. The data suggests that women that were overweight or obese prior to pregnancy might have a higher risk of a severe COVID-19 pneumonia. We're also worried about women that might have high blood pressure or diabetes in pregnancy or other kind of risk factors or high risk factors. We still don't have a good grasp on how COVID-19 can affect newborns. And we're not clear on whether the virus can transmit from the mother to the baby, although we think it happens only rarely. We also don't know the impact on the child long term when the mother's had COVID-19 during pregnancy. So there are many reasons to be careful and to try to limit contact with other people, especially in that last month of pregnancy. In parts of Western Washington where we have pregnant women that can stay home and work from home, we've seen very low rates of COVID-19. In other parts of the state where many women are essential workers in agriculture, we've had much higher rates of COVID-19, and this is a focal point right now for the Department of Health in Washington state. So some of the rates of COVID-19 can be explained by social determinants of health and who can stay home and who cannot. I think that we need to remind everyone that COVID-19 is not a cold and it is not a flu. It is a possibly lethal infectious disease. Lower risk activities for COVID-19 transmission would be anything that can be done outside, and especially where people can be separated 6 feet from one another. So, but anything that is indoors and in close contact would be much higher risk. So we really recommend masking when you cannot be more than 6 feet apart from people around you. We're also concerned about women not coming in and seeking care during their pregnancy when they should. We and many other hospitals have pivoted towards a tele-OB program, which is giving most of our care through telemedicine for the protection of the pregnant woman. But we absolutely think that it's safe to come in for those necessary visits with masking and with washing your hands and with the social distancing practices that we have in place.